issues. Okay, appendicitis is different from peptic ulcer, and they are not related in any ways. Okay, and the appendix is a different issue. If you are developing an ulcer, it may be as a result of different mechanism, and I call it ulcers. Okay, the appendicitis, intestinal, terminal end be a wasicum no one friend no appendix. Say a inflamed that about pain or right a lack fossa. Why I see Nifano so I ask one. I must have pain no. Then if as it were unbearable, they said they hadn't resolved it and all that was equally appendix maybe for peptic ulcer, you want 2 types, and then I affected stomach as it is. And it be so affected with duodenum or intestine. Okay. And young people usually have tiny duodenal ulcers. And now more older as a stomach or gastric ulcers. More older than the problem and obia ulcer symptoms when you're old we need to be able to be aggressive in our management to make sure say any malignant and it's any cancers. Young ones they duodenal ulcer usually is caused by an organism known as H. pylori. The amount of medications to clear the H. pylori, we should be clear of peptic ulcer. So the appendix and your ulcer may not be related. Okay, and no politics. Okay, let me see. Doctor, please. Is there a correlation between homocysteine metabolism and hypertension? Not really a direct causative way, causal relationship. Not really a direct causal relationship. But usually any metabolic disorders biano any diabetes, hypertension, hypercholesterolemia, metabolic syndrome. Usually it is likely you'll get the other. And any form of metabolic disorder biano, you need to see an endocrinologist or a heart specialist if you're hypertension, so that we'll be able to manage you well and prevent you from developing the sister condition. And basically that is it. Or metabolic problem, you just have to keep an eye on it. See a specialist who will be able to prevent you from getting into any other complications. Okay, so let me see who is next. And then health. So politics now, men pick a politics for. I say I sleep and wake up with severe body pains for 6 years now due to an accident. X-rays, but finds nothing. Severe body pains. It can be all over your body. Miss Lindokia. Anyway, I'm sure I got the name right. It can be all over your body. So it has to be specific. Maybe an hour spine, side, hole, and ass. So come again, describe it well. Let me know which exact location of your body now your problems. Let me know. Yes. Okay, so Dixie said that can we talk about ectopic pregnancy? Yes, so Oba Ewo reproductive tract. I had to say macho man saying it here. Okay, you can't see my whole body, so you appreciate it. So fallopian tubes, ampulla fallopian tubes, connected to uterus, and our ovaries were no same. And the ovaries in the ovum, eggs no, sperms fertilizing no. Sperms fertilizing now. We'll have to move all the way through the fallopian tube into the uterus. Okay, if I am moving through amateur uterus, let's say implanted on any part of the fallopian tube outside of the uterus now, and what here now, and your friend ectopic. Ectopic needs me a bit makoto baby, a bit makoto abdomen, a bit makoto baby. It can be a free ride ectopic, but in most cases, no, I have fallopian tubes, no, So near my course, Say, oh, when your ectopic there, you can most likely get another ectopic. And to keep that in mind, when the ectopic there, that's the major one I need to let you know. Yeah, well, PID, infection with PID, and this will affect fallopian tubes, no society. And see, and also say, when a bad PID, you want to change here and all that, and so much money, we say ectopic. Instrumentations, DNC a trim, this is not DNC beyond. But I mean, if there is any crude instrumentation into the uterus, so it may develop different adhesions. Adhesions also to preventing we say from implanting well into the uterus, no. Okay. And I say be a medical procedure like HSG, when you have frequent encounters with that, so out to mean ectopic predisposition. When enter happen, IUD, unfortunately, don't get pregnant. Most likely, we don't ectopic by enter happen. So don't be scared. Na emaning run also IUD. So basically, that is it. Say, sac nini within the fallopian tube. Now we're in tema. About pie fallopian tube, no. The pie fallopian tube now. What's that ability within or abdomen. Okay. So usually, say, what tested positive on PTR. The next step, you have to take a scan. More and more, you're found of taking concoctions. I will be drew, or man say, ma, I will check it, two. But I don't be recommend this say, Abia, I will be drew you or turn no more, obey okay, and all that. This so, all the usual class of a hospital. Now the other one no more be drew, and now whatever you want to do, try and take a scan first before you go ahead to take whatever you want to take, which I still don't advise anyways. Okay, because take a scan a bit more actually whether say at the uterus uterus before you go ahead to make any decision thereof. Okay, into when the ectopic that the catch here say usually say if we have to take the fallopian tubes up, you bet out there, you bet me use medication at the ectopic no. But there are some criteria you have to meet. One meet this criteria and the best said you need a fallopian tube. And there you one fallopian tube free where Bako na akano. You can still get pregnant with it at your own money now. But when ectopic there, you can also get ectopic again. Or other fallopian tube. And you win an ectopic near you back free. The next person you're going to go out with, make sure say the person is your either husband or you are very sure say more. Because the point is that if you back with you, now say another ectopic with or boyfriend that on marry and all that you could back with you are two fallopian tubes in now. And naturally, so better conceive no any possible. This is what we call IVF, an amount. And your husband, they are now during the time of marriage, bakono akahua and your marry. So whatever it is, you will get his full commitment and full support, so that you'll be able to help you or assist you financially to be able to do IVF. And that is the way ectopic. Okay, hey, I am a man. My question is also how to cure candidiasis. Candidiasis need to see a bit difficult. Not difficult per se, but the point is they have to be radical and aggressive. And I say, a personal hygiene first. Make sure you keep a good personal hygiene. After all the medication, you have if we have more pastries, if we have more orals, whatever you have, make sure say underwears or panties, whatever. Either say scar, or bit much changing now. That is one. So when you changing no like no one in so shame more power, no one in so shame. We see ya no one. So that if there are any hyphae, any organisms left, they'll be cleared off. Is that okay? If you are fond of hanging or underwears, or bedroom, or room near you, learn to dry them out, or ewiem, so that any form of organisms be any good medium to grow. So these tips of personal hygiene, make sure you take good note of it. During the menses, also try so we keep to either bath twice or thrice a day, depending on how heavy we flow a year. Say if you're not using powder, and I say any politics, but I mean, kakra. His Excellency the President, it's our problem we our boy or my females free sanitary pad no. It should go a long way to help your man no. Okay, could be use racks into my goodness and man in the air or my okay. Even in the worst case scenario, we be use making sure say what boiling or the see just so on that kind of thing no, to make sure say untransmitted any other infection or doing or way no. But thankfully, His Excellency the President are providing for all this. I'm sure say we shouldn't be having all these problems moving forward, because during the menses no, blood and a good culture medium for a lot of organisms. During that period, no, your hygiene must be top. Again, partners no treat you almost. In most cases, what me talk, but now partners are the amount, all that kind of thing. No. And once you are treating for any sexually STI, any reproductive tract infection whatsoever, as much as possible, try and then carry your partner along so that you'll be able to have that holistic care. Is that okay? Usually I focus on STIs, but Candida, any of the other reproductive tract infections, try and carry your partner along so that you'll be able to support each other in the treatment among others. Okay, what may all this are really there? Public toilets, any other facilities will be used for washrooms and all that. Training in Dettol, I'm not advertising for them. I mean, detergents a bit more to kill most of these organisms whenever you go in there to go and use. So I think that once you're able to keep an eye on this, you should be fine. Next question. Allergies. So ladies, allergies there. A wide range of food allergy, dust, all the form, hay fever, all the forms of allergy. In the allergy, the best thing is to identify your trigger. Who identify trigger and avoid it. Asthma, all these bronchospasm, a form of triggers, a trigger, then you're able to have all these reactions after Omasa obedi granulating IgE producing pathophysiology. Okay, I think that is it. Yes, IgE na cause all the reactions, diarrhea and bronchospasm and phlegm and all that. So the first most important thing is identify or try as much as possible to identify what trigger. Into what asthma na any of these rhinitis, any of these as it were nasal allergies, dust, smoke, whatever. Try and identify it and avoid it. Food, so there are specific foods that normal allergy. Then you'll be able to do that. But I mean, the treatment usually almost similar, but not the same. But if you are not able to identify that and all that, just visit a clinic. Your doctor will help you, take a good history from you, and will be able to help you trace whatever is causing that allergy. Then we'll be able to help you in that regard. Okay, thank you very much. Mama, who is lucky? Questions in the door. I said, doctor, please, what's your shoe size? Hey, Gabby, my shoe size is 45. My president is a shoe number 20,000 Ghana cedis. So let me declare. But my shoe size, that is by the way, my shoe size is 45. How can you treat fibroids? Okay, so fibroids, common, very common. But until say overt symptoms, usually it's our picking on scan and all that. We don't really want to worry you. Unless say be a cause pain, a degenerative, and I say accidents, hemorrhage, like a bleeding into the fibroid no bleeding across the inside, and I say I infected, and I say baby you want no prevent fertility, okay, and I say I'm aware very distended, I cause a lot of discomfort, symptoms, baby, then we will be able to look at it, okay. But the point is that most females are prone to developing fibroids. Usually, when delay or more a childbirth beyond 30, 35 corner, you always have these problems coming up. And the early marriage, early childbirth, very encouraged when it comes to these issues. Even when it comes to breast cancer issues, early childbirth, breastfeeding and all that. A man problems in the donor edifio. But fibroids until say a overt or these kind of symptoms on board, usually we don't. And I am bleedy baby, raja, am bleedy baby during the menses. Then we'll be able to look at it and then see. Doctor, can fibroid cause severe constipation? Yes, of course it can. If a pressure symptoms are here say, Adna kasi baby with now wayasi. And the structures are holding no because they move doing air compressing on it. Just like when you're more a air kasi do stage bia with some pressure symptoms. Either say every more Johnson 10 every more constipation and every more can say superior diarrhea, forced diarrhea, like I say, irritating will rectum no in a way said that time there you feel going to the washroom. And these are pressure symptoms running now. Fibroid so bet me a bit me quite compressing on veins in the hono or 9 hono can even cause these compressions and all that. Say una all these problems you have to take out the fibroid. We take it out. Remedy for ulcer. Also, you want to be ulcer. They down now, honey. They will be down now. Ulcer. They will yema ulcer. They will gastric and now peptic. Will duodenum and also ulcer. But I'm sure say ulcer now will refer to the peptic ulcer, which is gastric or duodenal ulcer. Usually, in about 70% of the ulcer cases, no, it is caused by organism be a friend H. pylori. H. pylori. So what we do is see a man be a friend triple therapy. Once you do triple therapy in the Bemauno, in most cases you should be healed of the ulcer. Great. Debium. What's the next question? G6PD food effect. Hey, this SPD are doing. Glucose 6-phosphate dehydrogenase. So it's an enzyme. It's an enzyme that helps prevent what we call oxidative stress. And the enzyme a boa, meaning say the mention to the tree mouth. Into red blood cells no. O blood no. O hair blood ma o white blood cell or red blood cell na o platelet. White blood cells no boa ma o infections. Red blood cells no e boa ma o transporte oxygen from our lungs all the way to tissues ni onema no. Okay, and our platelets so boama bibichawa na aclot. GSPD affected red blood cells no in most cases. So what happens? They say red blood cells no travel all the way from our lung to heart to tissues now. Now we're losing the oxygen now. Pressure be breathed so from what we call free radicals into this is speed, to produce other reducing agents, NADPH, and I think that is the pathway, yes, to help say maybe all these free radicals. Now, M cell no empire, and I will be a friend hemolysis. Hemolysis is a red cell now the upper. Okay, and do what this SPD food deficiency. That's an enzyme in your car. At any time you are subjected to any form of oxidative stress, red blood cells ever start to say a hemolysis. That is a papai and a bestie because of that oxidative stress. Okay, and a bit more causes severe problems. Yeah, well, near maybe it may trigger and as it may as it were yes, a trigger oxidative stress, no. Sulfur containing drugs. And medication we went to hospital we sell and our Jesus the card that dema obia was a deficiency no. And to hospital yeah and now obia near Musa craft volunteer the information. Never card next or doctor and so yeah Jesus the deficient. Okay. It also most of the common drugs are causing oxidative stress no. Me a doctor waba now may prescribe I will ask you that direct question. Are you Jesus the deficient? Okay, and sign your prescribe usually sulfur containing drugs. No, yeah, when you are any and near be so and precipitate apart from drugs. You also been the fava bean, I think so. Yeah, fava bean, and the also to precipitate this is PD crisis. No, say crisis this year. What happens? You say because of red blood cells, no, pie, no. Emu content ni nyina be yi e de go bloodstream no e go bloodstream no majority of we no ye hemoglobin any iron hemoglobin also with liver e yi ni nyina pie let me bo ase de be ya toxic and say o kidney any other organs but because war crisis into no liver no entimi nyina ada rate cells ne say no and you when so better tia all these jaundice symptoms, were neighbors that yellow, and some was clear, or numbers that yellow. Having now Johnson and Casas started dark and all that. I don't know. Anytime you are this speedy deficient, and it's a case of partnering now, almost all the red cell disorders, part and the symptoms almost the same. They're making most of them pass for sickle cell, most of them pass for spherocytosis, most of them pass for all these even partial defects from sclerotic crisis. And no, there is no more or less like a cure, a part, a defect from birth, and once a defect of that nature, no, won't mean cure. So you just have to know about it, be on top of your game, know the symptoms so that anytime any of these issues come up, you'll be able to know and then seek for help from your medical practitioner. So that is it for you on your D6PD deficiency. Can ulcer be cured? Yes, ulcer can be cured. I think I've answered that already. What causes reduced fetal movement during third trimester? In the fetal movement, usually your mama say what are symptoms na your mama chat bia mo plot my time you better sakra keke bia no then you take it, okay, and you record it just to help us know how active baby no yede etien. So enti baby no take baby no as akra oda oyemu a one channel all the way till so be give birth. And to be affecting the well-being be a bit mama crying movements, no, as what common anemia, no, so much as what here. Meaning say muja kwa crying so better and all that. And any cause of anemia in pregnancy be everything I consider. And no who bleeding before we even APH, antepartum hemorrhage. Any cause of that be an bit or placenta previa, any of these problems be a bit mama akran, or just what ya ma affect akran. So akran who so sound, oligohydramnios, and this bit me ama akran so ne well be near their thing now bit me acoform. Say intrauterine growth restriction. Akran nina also one at that pace I share for every week, if a crown according to that pace, and also a crown movement name and name with me acoform and all that. So these are the things that at that particular moment in time, so it may affect your crown and all that. So these are the things that comes to mind of head. But anytime want your crown can you like you used to, make sure say you report to your clinician. Maybe also who hyper movement are crying moving excessively more than a crying should, and also you should be able to report that to your your clinician, okay? Cord no so umbilical cord no if you compress at any point in time and also akra no message where may have some changes in terms of their movement and all that. Let me pick the last two nothing. Minimum health issues. No? Last to them minimum health issues. Let me see. High pressure. High blood pressure. High blood pressure there. Low blood pressure. Hypotension and hypertension. And the hypotension, okay, for layman, make us say anytime one blood pressure no less than 100 the was no less than 100 and you be out check your mommy dey with you. Anytime be out check be less than 100 the was no. Now the off form no less than 60 be no. You have to call your doctor. Okay? For hyper no, anytime I check be less than the minimum 140, less than 135. Now extra the NC more than 85 will be check up at the hospital and report it to the doctor. If I was checking this year, maybe I'll be now 135 and 140 and 150. But maybe I'll be nice in your mission. Home to boss in my home sometime, my home 2 hours, maximum 4 hours. Also, I check it. Let's say that same high and low, especially a higher, report it. I am well. So hypertension, that's low blood pressure now. When say I say when you should brew unto me or leave come so as a bond 10 but still no pressure no low. When your symptoms are come, they should tell you say you're having problems with hypertension. Hypertension and tendency. Usually this area will bleed baby. When you accident bleed baby, and I say hypertension medications maybe alcohol overdose be and some idea when you hypertension. Hypertension so the never be in a genetic lifestyle. I can see baby sedentary lifestyle when you exercise or diabetes already, any of the metabolic syndrome, and also to me the hypertension here then. But hypertension no say usually won't tell you symptoms and them. Okay. Who was on checking the pressure crowd? Frontal headaches. Utitimi draw na ye ohonya she bibia nsi enso na uti edwaw sa onom many of these pain medications you cry na still and conform and all that. It should prompt you say be now pressure no after the having. But once you ever diagnosed this or hypertensive or hypertensive drugs be also no, try and get a home BP monitor so that if there is any issue whatsoever, you'll be able to monitor it. Thank you very much, guys. I think say on more requests, I think say politics not too much. Before politics and all these things, we used to come here and then have these discussions on your health and all that. Okay, and see, I said not the health based. I'll pick just 2 or some few people. Then you talk to me. Then I'll see how best I can be of help to you.
Hi, Doc. Good afternoon.
Good afternoon, Professor.
Sorry. But what's my way? Now, make sure pass and only communicate what has seen, no, because any all the politicians, no, I been your home time. So, what my home say, like, a Jumana, the show was harrowed and the Manatra, a brosso. I mean, sure. So, me, I'm a high blood pressure, no.
Okay.
Or say, we should monitor it. Now, me no be a mason, but I have that problem. And Pasha say,
what did you say?
Oh, me konya 40.
Okay.
Yeah, I have that problem. Me Pasha meet you.
I'm say now what come before the just when you say no. Because
I have me what's that problem no. I've been to the hospital. You know, mama me no. Mamba could be almost a whisper all. 2.5, but me family so Nancy
Okay.
me bagan and I me call this about hospitals and mama me drona. I've started taking it. And I'm praying say I'll be okay with that. Yeah.
Okay. Okay. And see, who get close to 40 there? Hypertension, no. There were two types. There were primary, there were secondary. Secondary, they say, maybe may cause hypertension. It's usually, if you find out what is causing hypertension, now, it means a boy problem here they feel. And you, come, or and you are next swelling, and now upon a cry. And who you cry now, usually a bear hormones. Yes, it's because secondary hypertension. If that has not been done, the therapist especially, so much screen all this to see if the cause here or adrenals. And you be that organ be that kidney so. And also to me, produce hormones and also have problems for among hypertension. Meanwhile, maybe we'll cut in and off for that. But you're common usually after 40, 50, 60 whole or common ever. But when you're young, they are now hypertension. Most at times you need to do all these screenings to be sure say they are causing hypertension. No, you do what they are, then you have the primary hypertension. And you know, you guys say cholesterol, that was true. And I say, oh, diabetes you are carrying somewhere, and now heart related issues. Help out for not to condemn them, but apart from a more. I go school or home man. They hardly want to investigate the cost of body. They are only interested in selling their products. And I would recommend say, so don't pursue big guy head down completely. Try as much as possible to balance the two, so that you'll be able to, if a secondary cause, get to know it and then get some help from the hospital as well. Okay?
Okay. Doc Pacha, my last question. Me in next will have say or Jebini. Me year 9th. And now me catch me doctor say me I believe say ABR may have a sleep during the night in internal ecosystem. Can that also cause blood pressure? Night sleep.
Yes, and it's with my problems. Night sleep with my problems. The very big obstructive sleep apnea. Or that old baby. That is your partner can't want some story and all that. And also obstructive sleep apnea and cause it. It's a one that alcohol, it can be any other substance abuse, hard drugs and all that. All these things are things to look out for. It is a while sleep online and all that. And to start modifying your lifestyle. On your exercise. If you are too busy, if you are okay, $2 as well as $20 now, you have to modify a lot of things from exercise, the would and some of the lifestyle. But right.
I mean, from I mean, no people from God bless you.
Oh, good evening.
Okay, man. That's what I'm saying.
No, I'm proud of Pacho Nancy. Me Pacho Nancy. Me Pacho. Me
bisa. Hello. The phone line at go. Hello, Dafu. Father, it's me again.
Yes, Doc. Good evening.
Hello, Father.
Hello, Doc.
Good evening.
Hello.
Yeah, Father.
Yes, good evening.
Hello, Father.
Hello. Hello.
Good evening, everyone.
Pacho Eyom, Pacho Ose.
Hello.
Hello, Timenka.
Manya do no so wa bon plan.
Eh, mami si. Mami pese mi bisa first.
Doc, me pacho me question no unya no mame wada Roma na me bisa say early pregnant woman aduane bɛn na yema no.
O say o pese o bu se dey.
Early pregnant woman aduane a yema no.
Okay, first trimester. And the first trimester nankasa no, aya man be brief nim say aduane kwa na o makono. Okay, but first trimester na kwa ni nyine bebre. And most of the things you want to do, yes, say, and they are essential for acquiring growth, which is blood, definitely. Blood, no, also no. And they are a womb, open the iron. Iron, no, also no. Most at times, yeah, and they are green, no. And I'll be no womb. And the coins to sua, and then your friend is saying, contumely, and all these green leaves. You'll be able to get most of these things from them. Also, after now, what for me a cranity, vitamins, all these we say no, so you need them. And the folic acid especially. And usually fruits, orange, banana, and all these fruits. So you get most of these nutrients from it. Be as it may, first trimester, especially after 4 weeks, 8 weeks, all these are supplements to be able to push you in terms of quantity in here or blood levels. But if there's anything to go for something related to your greens and your fruits. If a blood will refer you to a dietitian. Dietitians, they are specialized in that area. They will sit you down, check your weight, check your height, and all that, and then get you a diet plan.
Because na omo ka say like o say ya ma mo de do na yo mo doctors no mo che say first ya na orange na acid na wo mu enye ma so be take acid. Is it true? Or orange?
Well, and I say first trimester no. E ma no obi an say de ye no. Obi o ha ne kon no hwe ofefe and all that. All these problems about and to be depending on nipa no specific, but there's not been any proving you say be orange those fruits no harm baby no in the first trimester. I've not come across any publications in that regard, but baby in the first trimester no and them will be any time the corn no will be.
Because my main point is already and fire your net of it. Well, I think that many months I'm afraid of me complain for MPP. I'm buying money. I do over the year what I say. Doc, Wadaroma, please, who is the new MC?
What district then?
Chrono. Also, they me throw and I make a show say, na ko yes, so for we dear man. MC, you know me de.
Tafu MC Sadik. Tafu MC Abubakar Sadik. So I would remind him. But as I send him a reminder or me DM so that I will have a look at the complaint again. Now,
what's up, Panacea?
Now, I drainage B and I know. Okay. Well, started you may need 2 weeks, and I'm sure say he's settling. But in case China Bibia, Oko should have somebody out there from Dinko, or hearing, then you attend to it for you, okay?
Hey, it is anime ko America there because
there's a renowned minister national.
The home make say wow, kita Bibia, proof bia, make say megwa.
Obet.
It is a best reference. Ene iso to ye they are higher power. Obi nko no bi aba. I remember say a former a local government minister may your consumer ba say ebe say omo han ko be say baby mama na. Then it is a man you contact bi anye follow up this and kwesi
And you so you can easily have a look at it from me. Why? Okay, thank you very much, Dofo, for that. Okay, so I think I'm picking my last two. How many more you? Mami Adra, this
Mami Adam Doc. Pacha on swear.
Name de men kwache me. Kasa no.
Doc, Yami sure we juma oh yeah. Me
Amen.
pacho, me wo yeah 2 years ni, but still yeah me Philippines or me Thai. Problem
So
better
your
man.
operation.
Pacho Debbie.
I know operation.
Pacho
What
Debbie.
time? What time if I a straw?
Right one.
Right
Nestro.
one.
Yeah.
Go there check your hospital.
Oh Debbie.
And you have to complain so that you examine the tie and then
Oh,
find
okay.
out if a localized problem and whatever is causing that, then we'll be able to help you. Okay, but I won't report it. I'm not too sure say how daily activities, but whatever it is, anytime you go in for checkup, no complain, they will have a look at it for you. Okay.
Pacho.
Okay, great. Mania, thank you for joining. That's been the same.
Jamiadu wa compassion aswe.
Mania, the mission here, Kasana.
Ne pacho. Ayana mitie me ya frequently ban tentem.
What is
That's
it?
right. 26.
26.
That's right.
Utini ya when you brew, air cell back free, who all be around it.
Pacho there be meeting pe. Emu no meeting say me ja.
Imunanga sano.
Pacho.
What yesterday you say there na papa na nyumwe ana wo ye adwuma che ana kom de one what yesterday be say.
Pacho there.
Utini ya affect your vision. Ama wani so egwu ana hu ade yi.
Pacho there be. Enwan say me ya.
Na say ya wo ye hye ana bibi.
Pacho there be. Meeting pe.
Okay, we na den akọ ana wo ha na no akọ.
E ho na no akọ.
Oda nyame a na ekọ ananse we stress than eba na visa wa make it be around it.
Okay, to me ya to us be 4 days. 5 days, 6 days na atoko.
Na no article.
Pacho.
Okay, so headaches there. The be white ba as migraine and attention headache and any of these ways. But now there's so a day we take it for granted for us as medics. The any headache is there and it must be investigated as to what is causing it. So that we don't box the idea into say they are experiencing migraines. Okay, next time I don't go hospital no. Say any headache no cry na do be na be na do be kwa. Kai, never mention to a doctor. No investigate furthermore. Why?
Pacho.
So that we don't take cross the right so we're tasting. Is that okay?
Yes, please. I'm
Great.
okay.
Okay, thank you. So, Minash is saying,
Doc Pacheco, Marie.
Marine. Okay, Marie, it's saying,
Pacheco.
don't got
Why you busy in my jaw kaka?
a job any day. You see, I buy the marble shoe.
Yeah, me too, me.
Because I'm not Marine.
Doc Pacheco, me also want. Na me Jane say me sorry na bi ada men didi yie no ana bi ankebe ha me ba me de no ada me didi te say me ka say ne de me di heavy food me didi yie no that day mom na me sorry na aka me
Enti,
yeah
Obi enu also you certify a ban outside was echo. Okay, and I usually don't like it when we so me also me so. It was a new also. Unless say you don't treat it well. So we want to treat you here and you bana kona and you no necessarily also and but symptoms na e ba no you neko. What they now would describe it also if it be GERD, gastroesophageal reflux disease. GERD.
Doc no last year no school clinic for try me say menye no but before no na makwa career mom say peptic mama makwa akoye test ubo word bi H pylori na o kan no me koye test na no bi wo yes nti de bia say ne mom ka say ma mindi ana na me take nuje o all the time go be last year no mo kan about this jet thing try me but me did ya nti they would ma show them say me di issue cause ọcha metu kwa me didi na metena baasi na ma didi a medu sunyane no na aka mato.
Ndio wade amde o hospital. Mo ba na mo de mo dice. Ye ntie mu ya. Ya kazo doctor mo malaria you are typhoid and something else. Internet the other carry and also get no said the one time would be heavy meal, heavy proteinated diet, meat the oily food the we are now that I appreciate that if you do a over and now say whatever try so the we are over upright for some few hours and then maximum 2 hours because you're very big time. We yam na jani koto ha usually by 2 hours time na PFP.
Oh, okay.
Okay. And usually say who remain upright for that 2 hours. When more are symptoms no e be PFP one have that whole flat and am fa koda wada. Okay. And God when you kumpa cry whatever. God when you kumpa cry whatever. Come on feedback sorry. Obi want feedback. Yes, come on feedback sorry. Yes,
Shut up. Good evening.